This presentation covers guided bone regeneration using Maxxeus allografts, presented by Dr. Dan Holtzclaw. This pre-surgical radiograph shows a hopeless mandibular incisor with external resorption. This tooth was planned for replacement with a dental implant. Clinical view of the hopeless mandibular central incisor. Note the erythematous gingival tissue and exudate below the crown. Following removal of the hopeless tooth, a significant bony deficit was present. The site required significant guided bone regeneration prior to placement of a dental implant. Here is an occlusal view of the significant bony defect in the mandibular anterior. A Maxxeus bone allograft was used to rebuild the bony defect in preparation for a future dental implant. It's shown here in an occlusal view. Shown here is the fascial view of the Maxxeus particulate used to rebuild the bony defect in preparation for a future dental implant. Here is an occlusal view of a Maxxeus Pericardium barrier membrane that was applied for guided bone regeneration. In the fascial view of the pericardium after application, note how the membrane lays on the graft nicely, without the need for tacking when it's hydrated. Periosteal releasing incisions were employed to achieve primary closure of the surgical site. Shown is the fascial view of healing at 3 months. Note the improved bony architecture and gingival contours at the surgical site. In the occlusive view of healing at 3 months, note the wide reconstructed ridge at the surgical site. Here is a before and after comparison at 3 months. Note the first appearance of a wide ridge for implant placement in this view of healing 3 months following removal of the temporary resin bonded bridge. Bony healing at 3 months shows excellent signs of vascularity and is remodeling nicely. At this stage, the bone is still remodeling and has a high percentage of osteoid tissue. These are excellent signs of new bone formation. Note the significant formation of new bone in the before and after comparison at 3 months. The reconstructed bony defect is prepared for placement of a dental implant. Note the well-vascularized bone which has been regenerated with GBR. Shown is the placement of a 3.5 by 16 millimeter tapered dental implant. ISQ readings of 72 were obtained at placement. This is a great indication of a remodeled site that has a solid foundation. This is an occlusal view of before and after comparison at implant osteotomy. On the screen is an occlusal view of the before and after view at implant placement. Shown here is the radiographic progression of healing. Without GBR, placement of a dental implant at this site would not have been possible. Presentation by Dr. Dan Holtzclaw, Lone Star Periodontics and Dental Implants, Austin, Texas. For information on Maxxeus brand allografts, visit www.maxxeus.com.